Family planning si kitu kwanza ati unaenda kumwambia mtu na wewe huko.
Kusema kweli, mara kwanza tulipoanza ilikuwa si rahisi kwa sababu ya dini.
Wanasema mwanamke akiwekwa hizo ni mwanamke ambaye ni malaya pengine.
Mobilizing challenges inaikuanga sana wazazi wengine hawajachangamkia mambo ya family planning. Wanasema kwamba labda mama akienda family kichukua kama hiyo coil atitakatikia kwa tumbo.
Kama kuna sababu yenye imekufanya, kama ni ugonjwa, mtoto kugonjeka, abortion si mbaya.
Some of the challenges that are affecting our women and girls in accessing sexual reproductive health is access. Facilities could be very far in most of the counties. Number two, if a woman or a girl is not well educated, they tend not to go for the services because they do not understand the importance of them being seen in the facilities.
As Marriage Stops Kenya, our sector of play is the sexual reproductive health sector. And if you look at the recent released KDHS data, then you realize that there's huge unmet needs. But also if we reference the ICPD 25 commitments that we made as a nation, you still realize that we've not made the necessary strides that we committed to those years back.
So one of the ways that Marriage Stops continues to collaborate is ensuring that we are working very closely with like-minded partners. And how we do this is, for example, we are participants of the Technical Working Group for Sexual and Reproductive Health, working very closely with the government, Ministry of Health, the county and sub-county government, to just be able to, one, share especially our data so that they can be able to see the contribution that Marriage Stops is having in provision of SRH services in the country.
The SFF project in full name is Swiss Family Foundation, a project which started in the year 2020 April for 3 years, and it just ended in March 2023 with the main objective of partnership with the Ministry of Health to make sure the quality services are offered in marginalized and very hard to reach areas. So we worked in 2 different modalities. The first one is to ensure the supply chain was addressed, to make sure the providers whom we work with, they are trained, the community which is there is aware the services are offered in those facilities. Then to ensure the clients receive the service, we had a public sector strengthening channel. We recruited the facility, or we onboarded the government facilities, whereby mostly they are from level 3 to level 5. So our main aim was to build their skills so that they can see family planning as a choice of the service, rather than them only concentrating with the curative services. So when we are there as an outreach, going for a classroom-based training sometimes doesn't add fully to the skills level. So, but in this situation, considering the mobilization have been done, you find averagely per site, we serve about 60 to 70 clients during that activity. So it means the providers who are there have adequate number of clients whom we can do the skills development for them so that they gain the competency level, which we call level 1, for them to serve the clients on the other day.
Marriage Stops Kenya supported us from 2019 with that training. When they came on board in 2019, the introduction was they're going to give us some strength. Particularly what was a challenge to us in Kimilili was IUD insertion. We didn't have the skill, including myself. So that the staff were trained in IUD insertion, and they've been being supervised by a team from Marriage Stops, Rose Chirchir. She comes on quarterly basis to see the skills, and then she assesses the staff and will be able to give marks and will help us address the gaps.
So I'm Cleophas Miriongi Simiyu, a nurse working in the MCH, Kimilili Sub-County Hospital. I'm working there as a PSS service provider trained by Marriage Stops International. The training was about medical emergency management and infection prevention. The second training was about long-acting reversible contraceptives, which includes implants, insertion, implant removal, and the IUD, insertion and removal. Before the training, I was not able to insert an IUD successfully. And what I have discovered is that the knowledge I gained from college wasn't enough. We just used to insert IUD. Then after a while, majority of the clients were coming back complaining of infection, like maybe discharge or whatever. But after the training, that is when I learned, before you insert an IUD, you need to do a CS screening. Tulisoma pia counseling, professionalism pia, confidentiality ya mgonjwa ikaingilia ndani.
There was a demand generation element in this project. And in the demand generation element, we are working closely with the community health volunteers, whereby we build their skills to ensure they are giving the correct information to the clients so that they can come for the services.
So basically, the role of demand creation under Maristop Kenya is to ensure that there is awareness within the community. And to achieve this, we work very closely with community mobilizers. And this is a structure under the government. It is aligned under community health strategy. At the top management, we have the community health strategy focal person, who is then followed closely with the sub-county community health strategy person. And then underneath, we have the community health extension workers. And then below the community health extension workers, we have the CHVs, who are now at the low level, and they are the ones who work very closely in ensuring that awareness is created in the community.
Majina yangu ni Johnston Olumasi, natoka kijiji hii Okimaru, Mwalia sublocation. Mimi ni community health volunteer. Vile vile nafanya na watu wa Maristops kumobilize wamama sana sana, ndio wanapenda mambo ya pangaji usasi.
Okay, kwa majina naitwa Reso Kuno, mkaaji wa Hola, Tana River County, ni community health volunteer. Pia nafanya kazi na Maristop kufikia kina mama, tueleze habari wa upangaji wa uzazi.
Mafunzo ya family planning, mwanzoni mimi nilishtukia ni hawa Maristop. Wamekuja wakasema kuna umuhimu muwe na haya mafunzo.
Mara kwanza tulipoanza ilikuwa si rahisi kwa sababu ya dini. Hasa mara nyingi ukiangalia wengi wao katika sehemu ya Tana River ni Muslims na hawapendi sana kuhusiana na mambo ya upangaji wa uzazi. Ijapokuwa kuna wengine mpaka sasa hawajapokea, lakini tuseme 3/4 ya jamii wamekumbatia hiyo hali.
Niliamua kufanya family planning mtoto wangu akuwe mkubwa. Wakati nifanya family planning, nimeongea na mzee wakubali, ndo nikafanya. Nimeweka family planning ya miaka 3 ile ya kuweka mkono.
Mzee wangu alikuwa anafanya hospitali, akaniambia kuna wazungu wanakuja wa Maristop, pia twende huko tusikize vile itakuwa. Akatusanya sisi wa mama wengi hapa, tukaenda. Wakatupea advice na madaktari malakisi wa Maristop. Nikaona heri niingie hiyo kwa sababu miaka 5 sio ni muda mrefu kuliko hii ya miezi 3 hii. Miezi 3 inaweza kuwa imefika umesahau, unastukia unashika mimba nyingine. Niliona uzito ya kasi. Kulea watoto na kasi ya shamba pamoja ni ngumu.
Mobilizing challenges ni inaekuanga sana sana wazazi wengine hawajachangamkia mambo ya family planning. Wanasema kwamba labda mama akienda family atapata kanza, labda atazaa mtoto mwenye hana viungo vingine za mwili. Such issues ndio ziko kwa community.
So as Maristops Kenya, then we work closely with the Ministry of Health, number one, to ensure that we reduce on the number of unmet needs. The other thing that we do closely with the Ministry of Health is to ensure that commodities are available. So we work with UNFPA to source for these commodities, but then UNFPA then channels those commodities to the Ministry of Health, and as Maristops we are able to access those commodities and provide service within the public sector outlets that we work in the different counties that we work in.
I have worked with Maristops because they are supporting us in terms of family planning, and family planning or child spacing in Tana River is part of the reproductive health activities. They renovated some facilities here in the county referral hospital and even other facilities. They have also supported us in terms of human resource mobilization of community. Like when we are doing the outreaches, they support the health workers in terms of commodities and also mobilization, support for the community health volunteers, and also DQAs, that is data quality audits.
We've also been referring our clients to them, those who require permanent voluntary surgical contraception like BTL or vasectomy, and they've been doing it for free. And more to that, the issue of capacity building when it comes to post-abortion care. Maria Stops has been very key to us as a county. They have been supporting our healthcare providers, training them. That is through on-job training. Some of them are able to offer these services and even to report to the KHIS. That is a major achievement.
MSK continues to be a leading partner in provision of SRH services in Kenya. One of the biggest ways that we are known to access of services is through our flagship outreach. So the outreach is where our team go out to the community and offer services to the most needy, especially women and girls in the rural communities.
As the name talks about family planning outreach, it's a team which moves every day to different sites, serving an average of 22 sites every month. The team comprises of 4 members, whereby we have 3 service providers, the clinical staffs. And in this clinical staff, we have one full-time employee for permanent method provision. There is a team leader who is a nurse. Then there is a team nurse. And when they go there at the public facility, we build the skills for the nurses who works there so that they have the right information to ensure they give the community members.
So the activities that we do in outreaches include health education to our community, that is health promotion, and tell them the importance of family planning. Like these far-to-reach areas, you find a woman has given birth to 12 children with only 5 living children. So we always advise them on the importance of family planning so that they can be able to take care of the small family.
We give pills for the women who are breastfeeding for the first 6 months. Then we have pills for the general population, Naitwa Chagua. We have implants, 1 rod serves for 3 years, then we have two rods for 5 years, that's Jadel. Then we have the IUD.
Each and every month through Marie Stops, the facilities that they support, that facility has every month an allocation for either an in-reach or an outreach program that they have to carry out, which usually helps us in service delivery. It helps us to reach out to our mothers who really need these services, and most likely maybe they could not have afforded the service, but they come really in handy. For example, we usually have camps for Marie Stops in provision of long-term methods.
So Marie Stop Kenya has partners with Mombasa County in various areas. Number one, we ensure that we support the county government in capacity building the CHVs and also the community health strategy docket. We also partner with them on matters to do with service provision, where the PSS sector has done a lot in terms of capacity building of the service providers, and also on advocacy on matters to do with safe abortion care and post-abortion care services.
So our main target was to ensure the adolescents receive the services. And when I talk about adolescent, I talk about 15 to 19 years. The way the strategies for us to reach the adolescents is a bit different with the married clients, because this one for adolescent is more on ensuring they complete their education. The second people we were targeting was anyone who earns less than $1.9 a day, because it means most of the time they don't have the insurance cover. So we are talking to them, giving them the sexual reproductive health services for them to have a good life, so that they can have few children and only have children when they have a choice to do it. And that's why we spread our wings to those very marginalized, hard to reach areas, and also put in activities which will ensure the adolescent services are provided.
Wakati niliamua kupanga uzazi, nilipatana na mama ambao alinihamasisha kuhusu Marie Stop na wakanipeleka hadi vituo vya Marie Stop, na nikaweza kupatana na madaktari ambao walinihamasisha kuhusu kupanga uzazi, walinieleza aina za kupanga uzazi, na mojawapo ambao niliona ni sahihi kwangu mimi, niliona coil. Haikuni affect, iliendana sawa na mwili wangu.
Mimba yangu nilipoibeba kwanza ilikuwa sawa, lakini mimi pia ni mgonjwa wa sukari na pressure. Ilipofika wiki 12 hivi, nikafanya scanning ya kwanza ilikuwa sawa. Ilipofika 23 weeks, nikaenda kwa kikundi huko, wakati wa kurudi nikaanguka na pikipiki. Kufanywa scanning ndio nikaambiwa kama kiumbe hakiko sawa. Ndio nikarudi nyumbani, nikaenda nikashauriana na bwanangu, ndio tukakubaliana, tukaja tukasafishwa na nikatolewa.
Kulingamana na mafunzo yale tumepata, pengine huwa umepata huo ujauzito, lakini unakutatiza katika hali yako ya afya, unahitajika uende hospitali ukamwone daktari, ili kama basi ni kutolewa huo ujauzito, huo unatolewa kwa njia ile inastahili kupitia kwa daktari.
Since the inception of this program, the outreach have delivered more than 500,000 CYPs. Whenever we are offering the services, each method there is a factor which we consider. And this CYP is what we call couple years of protection. So for the last 3 years, more than 500,000 CYPs have been delivered. More than 170,000 clients have received the services through the outreach program. I can say within the Project Thrive, we have managed to deliver more than 346 permanent methods in the counties of operation. And a case in point, an example for Bungoma, out of those 346, 56 of the permanent method came from there, the bilateral tubal ligation, and also the vasectomy. We had 6 cases in Bungoma. And also out of these numbers, 11% of the client whom we served, they fall within the age of 15 to 19 years. But one thing which I can share here very comfortably, Tana River, Hola, we conducted the first permanent method in the county. Then also, if I give an example for park services, managed to deliver more than 6,000 within the Project Thrive. And as you all know, initially the post-abortion care guidelines were withdrawn, but through our support, it has been reinstated, and currently all the public facilities can provide post-abortion care services following the guideline and the curriculum which we developed.
So long as you come in the facility bleeding, it is policy of the government to provide service to that client, irrespective of the reason why they came in bleeding.
And again, on the same services, we didn't have a consent form that a client can sign and say, I'm giving consent for this service. So some of them have even gone ahead to sue us. But with the consent form fully signed by the guardian or the caregiver, we are okay.
We want every child that comes forth to be a wanted child. So as Maristops Kenya, our focus will be on ensuring that we offer choice. And choice to us is ensuring that every client that walks into our facility, number one, is given a client-centered care, which is very quality service, but also is given a contraceptive of choice to them, and not the contraceptive that is available. And as we deliver this, then we have a number of strategies. Our strategies are pegged on 3 key pillars. The first pillar is the Leave No One Behind pillar, where we focus on reaching the marginalized communities within the country program that we work. The second pillar is the strengthening of the private sector. We focus on our AMUA facilities, which is a Maristops social franchise. We have about 100 facilities in country that have the AMUA brand. We also work within our 14 facilities. So as Maristops Kenya, we have 14 maternities and centers spread throughout the country, ensuring that we have a reach in all the spaces of this country. The third pillar is on a client-centered care, and our focus is to offer exemplary service that cannot be matched in any other facility in country.
So at Maristops Kenya Contact Center, we consist of customer service executives, we have a nurse and 2 counselors. We refer clients to service delivery points. We ensure a client receives a safe service. We also follow up on the client to ensure they received the best of services. and follow up to confirm they are doing well. When we look at the capacity assessment that we have just completed for 2022, Maristops Kenya has been able to provide 1.5 million women and girls contraception services. We have averted 1,914 maternal deaths. We have had at least 580,000 unintended pregnancies averted.
Mombasa County has been able to at least achieve an award for the best health service. This one we can say Maristops has also played a big role in it for its continuous support on ensuring that we have quality service within the county.
Some of the achievements that I would proudly say is support in development of the guidelines. Maristops have really supported government in getting that quality of data that we need in the ground for us to make policy directions. Maristops have taken a chunk of a lot of services that are being offered in half of our facilities in 47 counties.
Maybe what I can say, MSK has really helped us. Before that, nilikuwa nikiona kilandu IoT like you just want to meander, then you say mwenye anajua kuweka is not around. But right now, everybody working in the MCH, including me and other colleagues, I have done the OJT to other staffs not trained by the Maristop to insert an IUD.
Imenifunza kwamba uzae wale watoto wachache ambao wewe unaweza kuwalea na hata kuwafundisha.
So I would advise women out there to embrace the issue of family planning. And not only women, I want our men also to support our women.
Through my personal experience, wanaume wenzangu, hii mradi ya Maristops ni muhimu sana. Ukiniona mimi mwenyewe nina afya nzuri but sina kazi yenye nafanya ya maana, that means you will have time mama na kulinda, wewe pia unalinda mama.
Kwa hivyo na sisi tumejua kama si dhambi, wajibu sasa si dini, na baada ya mtoto kukua utaweza kuzaa mwingine tena.
If there are any side effects, you will be health educated and you will be advised. In case you need help or you need to be seen, you are at liberty to come back to the facility. The ministry position is let all people who need to use family planning and contraceptives for our girls can walk anytime in a health facility and be given a family planning method of their choice.
My call to action is family planning is not about a female going for family planning. As partners, we need to support our spouses so that they can have the right information when it comes to family planning, so that they can take the one which is necessary for them. We need to look at a healthy population. And how will we get this healthy population? Is whereby if we continuously space the family, you can have even 10 kids but space them. Then the third element, from the leadership, they need to allocate budget in the preventative management, because most of the budget is being allocated to curative, the people who are sick. But if people are healthy because of healthy timing and spacing of pregnancies, that's the family planning, they'll deliver us. The budget which is limited in the country might be used for other things. The education level will improve and the cycle of the poverty will be dropped.
Our advice is very simple. Your reproductive health is your responsibility, and it's a right within the Constitution. So anytime you want quality, comprehensive, affordable and client-centered reproductive health care, kindly walk into any Maristops facility and we will be able to give you that service.